Medicare enrollment is underway. Do you know what's right for you? I'm Eric Brenner. We'll help you make the right decisions right now on Your Wealth Health. Hello and welcome to Your Wealth Health. I'm Eric Brenner, owner and founder of Hilltop Wealth Solutions. If you're watching us on Facebook, please share us with someone who could use this information. And thank you for watching us on yourwealthhealth.com. Joining me is Bill Davis, a private wealth advisor of Hilltop Wealth Solutions. He's in his home office. And Sherrie Kramer, who's here in studio with me, and we're social distancing. She is a Medicare and health insurance expert with the Sanders Agency located in Mishawaka. And she's here today because we're focused on Medicare. You know, it's complicated. And we want to show you a cartoon to lend a little humor to it. It comes from a company called Target Medical. It shows a man trying to figure out the different directions he could go. Bill, this looks a little bit like you. But there is no GPS for Medicare except for people like Sherrie who have training and experience. So a little humor, but you know what? It's very important. And we know that many of you out there have multiple decisions about Medicare. And so we want to begin with kind of a Medicare 101. You know, kind of take you back to the basics and just kind of explain how it works. So Sherrie, let's take a look at the first graphic, right? And let's just give an overview of Medicare and how does it work?
So Medicare works, there's two parts. There's Medicare Part A and Medicare Part B. Medicare Part A is going to cover your inpatient, your hospital, skilled nursing, emergency care, hospice. Part B is going to cover your medical, your doctor visits, lab work, durable medical equipment, those types of things.
So Bill, you know, we, in working with clients, often, you know, people get pretty confused pretty quickly, don't you think?
Yeah, they sure do, Eric. It's, you know, it's always a blessing when we have clients that get to the age of 65. You know, medical coverage has become just so cost prohibitive. Even many group plans, employer plans, can be cost prohibitive with high deductibles. And so when it really is a blessing when we get a client to age 65. In many instances, we see the cost of coverage going down with Medicare Part A and B covering about 80%. And then as we'll get into today on the show, having the ability to either use the group coverage as a backup to Medicare or to have some type of a supplement or an advantage plan. So we're so thankful about what Medicare is. A lot of people also get confused between Medicare and Medicaid. And so what we're talking about today is people that have achieved the age of 65, whether they're working or not. And, you know, they're able to now apply for Medicare.
Yeah, so Sherrie, so you know, you get given to you Part A, you pay for some Part B, and then is that enough for people? Do they really need supplements? And I know that gets confusion. I know we've got a graphic here to kind of explain that.
Well, that's absolutely, they need something that is going to help cover those parts that Medicare doesn't cover. Medicare is going to cover about 80%. You want something to help protect you with that risk of that other 20%.
So if you look at the graphic here, then there's some different choice, right? So you've got you know, Medicare. We can hear about Medicare gap plans, and we hear about Advantage plans. Let's kind of what are the differences with those?
So once you've signed up for your Medicare Part A and B, then you are going to want to look for either a Medicare supplement plan and a prescription drug plan, or you're going to want to look at the Advantage plans.
So digging a little bit more into, I mean, do you see most people doing one over the other, or what makes the difference?
We really see about 50-50. We have about half of our clients who are working with Medicare supplements and drug plans, and the others who are working with Advantage plans. And there's no right or wrong answer. It's really finding the solution that's going to work best for your needs and to fit your unique individual situation.
Okay. And Bill, I know you working with clients within the firm, you know, you hear this, you know, many questions often.
Yeah, and you know what, some people make decisions based on a premium payment, and don't go in depth like we will on this show today, going into, out-of-pocket costs. So it's very attractive to look at Medicare Advantage, especially for a client that's, that's healthy and doesn't expect to have a lot of money, out-of-pocket costs or a lot of doctor visits or prescriptions. But many times I find that a supplement is a little bit more expensive, but it's a little bit more comprehensive, and we can pretty well predict what the out-of-pocket costs are going to be. And that's always concerning to me, is the unknown of being covered by Medicare Advantage. And then, I'm healthy today, but what happens, if I get in a car accident or, something like that I have broken bones or things that are going to require surgeries that are going to then possibly be covered by the Medicare supplement, and could have large out-of-pocket deductibles for Medicare Advantage. Just my observation, working with clients that are aging into age 65.
So, Bill, what are a couple of the top questions that you experience in working with clients, as they're entering into Medicare, that maybe we want to ask Sherrie? We have the person that deals in that all the time, and I know we tell clients that, once you get close to 65, your mailbox will be full of stuff, and don't buy it through the mail, right, or through an 800 number. So what are some really couple important questions to bring Sherrie in on?
Well, yeah, because every individual and every family situation is different. Do you require regular dental care? Do you require regular vision, optical care? What kinds of prescriptions are you taking? And I would think that for Sherrie, those would be the kinds of things that she would need to learn from a prospective client that would lead her to try to kind of plug the gaps with whatever the best plan would be.
And that Bill brings up a good point, Sherrie, on the drug and prescriptions. And I know, working with clients that I work with and you have consulted, understanding what prescriptions you're on, how important is that in trying to match up a plan?
That is extremely important. The costs vary from each carrier. All carriers have to have some parts of each drug in their plan, but all drugs do not have to be covered. So it's important to look at how each individual plan is going to match up with your prescriptions.
So literally what you do then is get the prescriptions that are being taken and then match it with what might be best.
And do a comparison.
Okay. And then Bill also mentioned dental, vision. How is that covered, once you go on to Medicare?
Well, Medicare does not cover dental, vision, or hearing. It also has limited coverage with home health care. So if you do a Medicare supplement in a prescription drug plan, then you can buy standalone plans that are going to help cover your needs. Advantage plans may have some of those benefits included in those plans. One of the things that is really important is the short-term health care, to make sure that if you have to take care of someone at home, or you need that extra help, that you look at those plans to help cover those costs, because Medicare does not pick up those at 100%.
Those costs. Okay. So under the plan, then it's not just about saving $1.
Right.
There's really a lot more that goes into it.
You have to look at your individual needs and what you think you might need down the road, and try to match up the plans that are going to work well for you.
Great. Okay. Thanks. So now that you know the basics, how do you get enrolled, or how do you renew your coverage? We'll explain when we come back on Your Wealth Health, and we'll have a couple phone numbers you'll want to write down. Stay with us.
built on a legacy 4 generations strong. Clayton Hoover & Sons Home Improvement. More than just our business, it's a family legacy.
Welcome back to Your Wealth Health. I'm Eric Renner, the owner of Hilltop Wealth Solutions, along with Medicare and health insurance expert Sherrie Kramer of the Sanders Agency, and Bill Davis, who's a private wealth advisor for Hilltop. You know, Medicare enrollment is between October 15th and will continue through December 7th. And we want to discuss some questions people have typically about enrollment. And the first thing, though, we want to advise is you want to contact someone who knows what they're doing, you know, who knows your situation and can direct you to make sure that you pick the right plan. So a couple numbers there. You'll see our number on the screen. You can give one of our advisors a call at 883-889-7526, or you can call Sherrie at the Sanders Agency at 574-255-1875, and she would be glad to help you and direct you. So let's talk, Sherrie, about this open enrollment process and, you know, really what is it? I know it's for those that are new, but kind of what do you do during that process and during that period of time?
Well, during that process of open enrollment, we are going to be reviewing plans. There are people who fall into new because of turning 65 during that time frame. But for the most part, open enrollment is going to be reviewing the plans that you're currently on, your prescription drug plans and your Advantage plans.
What about, what information would someone need for open enrollment? I mean, what do they need to kind of bring to that appointment?
So the important thing is going to be to make sure you have a complete list of your medications that you're on. If you're on an Advantage plan, you're going to want to have the doctors that you see, both your primary care and your specialists. What hospitals do you prefer to use, so that we can make sure to look at a plan that's going to have those doctors and hospitals in network, and to make sure that the plan that you choose covers your prescriptions well.
I know we, you know, Bill and I work with clients obviously, you know, every day. And so Bill, you had indicated there were, you know, a couple kind of those questions asked a lot of your clients, and you wanted to ask Sherrie.
Yeah. I mean, it's, you know, first off, I wanted to also interject that, you know, they should be contacting SSA.gov or Medicare.gov about, you know, 3 months ahead of time to get the process rolling as far as getting enrolled. And then seeking consult of a professional like Sherrie. So Sherrie, when I always get a little bit confused when I'm looking at prescription drug differences between Medicare Advantage and Medicare supplements. Are there some pretty significant differences between the prescription options if you're on an Advantage plan versus Medicare Med Sup?
Well, the prescription drug plans, each carrier is going to have their own formulary that they have, and they then put the drugs in that formulary into tiers. So every carrier can have a big difference in coverage based on where they put those drugs in the tiers. So it's always good to look at all of the options to see which one is going to fit you best.
So, you know, I said in the first segment, Sherrie, that for someone that hasn't gone through this process and getting close to 65, the mailbox fills up, doesn't it?
It does.
So what's your process to kind of help someone through? Because, you know, we at Hilltop certainly don't recommend people go that route. There's a lot of choices. How many carriers are there?
Well, there's a number of carriers.
Okay, so a lot of carriers. So kind of what's your process? How do you take someone through to make sure that they're making the right decisions?
Well, the first thing I'll do is have a client call me and schedule an appointment, and we do a Medicare 101, a little bit more involved than what we're doing right now.
Yeah.
We're going to make sure that we let them know what all of the options are, so that they can feel comfortable whether they choose that Medicare supplement and drug plan or an Advantage plan. We find out about what their needs are. We look at their prescriptions. We find out what their comfort level is, because there's a big difference in cost. With Medicare supplements, you have a higher premium, but you don't really have to worry about surprise bills. Advantage plans, you can have a lower premium, but you pay as you go, and you need to know that there's going to be some out-of-pocket expense, and it's just a matter of what is your comfort level with that. So we lay everything out and then let them choose what they feel is going to work well for them.
Great. Bill, you had another question?
I did, yeah, Sherrie. So if somebody's in a plan, so they enrolled last year in a Medicare Advantage, can they change? I mean, how do they go about, if now they had an event and they paid a lot out of pocket because they were on the Advantage plan, what's the process to change?
Well, when you first turn 65 or enroll in your Part B, you are going to be able to get on a Medicare supplement with no medical questions asked. If you choose to go with a Medicare Advantage plan and 3 years down the road you decide, I think I want to go back to a supplement, as long as you can pass those underwriting questions, you'll be able to find a supplement that will work for you. If you were at a point where you couldn't pass underwriting, then we would need to just try to find the plan, the Advantage plan, that is going to work best for your needs.
So underwriting is questions only?
It's just questions
It's not
only.
a medical?
They're
Okay.
just going to ask your medical questions.
Okay.
And there's certain questions that are going to be a knockout. The companies are not going to accept you. But there's many carriers, and they all have different sets of questions. We're an independent agency, so we represent many carriers. And just because one company, you may not fit into their underwriting, but another company might work for you. So we do all of that research and homework and try to help find the plan that is going to work for you.
Okay. So that's going from the Advantage to the supplement.
Right.
Can you go from the supplement over to the Advantage?
You can go from a supplement to the Advantage during that annual enrollment period.
Okay.
Of October 15th to December 7th. At that point, you would then, I lost my train of thought.
That's okay. Yeah, you'd be able to,
me
you'd
that
go over
question
from the supplement over to the Advantage plan, and
Right, and if you had the supplement and a drug plan, then during that enrollment time, you could sign up for an Advantage plan that would be effective on January 1st of the following year.
okay. What about additional coverage? So it doesn't cover dental, vision. The other thing is travel. So, someone travels, maybe, wants to travel overseas, things like that.
Well, it's always good if you're going to be doing traveling, and hopefully we'll be able to do that again soon. At this point, there's not
Right,
that's
not a lot of
big
overseas
concern,
travel.
but it's something that when we do have that ability to travel, you'll want to find a good travel plan because Medicare is good in the United States, but it doesn't carry over into other countries. So find a good travel plan that's going to protect you.
Okay, and dental and vision's not covered under these plans. You have to get a supplemental dental or vision, or?
Medicare supplement plans do not have any dental, vision, short-term health care, and you can buy standalone plans. Your Advantage plans are going to, some of them may have some dental, vision, hearing, as well as other benefits. So there are things to cover if your plan doesn't have that. It's just, that's why it's important to sit down and look at the needs and what you think you might be interested in, and we can help fill those.
Okay, thanks. So what would Medicare look like for the average retired person? We'll show you a case study to help you better understand. Stay with us. Your Wealth Health will be right back.
In our industry, the buy here, pay here industry, having repeat and referral business is usually a very small percentage of your business, like maybe 2%. But here at Instant Auto Finance, like 20+% of our business is repeat and referral. So with our referral program, anybody who comes in, we're going to ask them, hey, how did you hear about us? And they'll say, John Smith or Betty Sue sent me in. We're going to put that name down, and when that individual buys a vehicle, the person that referred them in, they get $100 every time, unlimited.
Welcome back to Your Wealth Health. I'm Eric Brenner, and we're talking about Medicare. We want to show you what it might look like for an average retired man. So, Sherrie, we've put together here this illustration on the screen. If you just wanted to walk our viewers through what we're looking at here.
So what we're looking at here is that you have choices. If you turn 65 and you are continuing to work, you need to decide, am I going to go on Medicare or am I going to stay on my employer plan? So if you were to stay on your employer plan and you look at that average premium, it's going to be about, we're just using a male age 65, non-tobacco. That premium will probably be just under $600 a month. He's got some dental, $47.77 a month, and vision, $9.37 a month. That out-of-pocket maximum is really a range between anywhere between $5,000 and $10,000, just depends on what plan you're on. And our subject here has an out-of-pocket of $7,500. So if you add all of those costs up for a year, you're looking at $7,771.59, plus any of that out-of-pocket if he was going to have something serious happen to him. As he looks at his Medicare choices, if he chooses a supplement plan, he's going to have his Part B premium of $144.60. That's the average premium for most people that they will have to pay for Part B. And then he'll have a supplement premium, drug plan premium, and then for a Plan G, $198 Part B deductible. So those costs come up to about $3,621. If you were to look at an Advantage plan, he's still going to have that Part B premium. If we look at an average Advantage plan, about a $20 premium per month, but they have a lot of out-of-pocket. So that ranges anywhere between $3,700 and $6,700 a month, depending on the plan that you're on. So the cost of an Advantage plan would be just under $2,000. And remember, Advantage plans also may have those additional benefits of dental, vision, hearing, those types of things that your Medicare supplement wouldn't have. So that's where we come into making those choices of where's your comfort level.
Yeah, and it's quite a difference in premium. And Bill, I know, and we run across a lot where people want to just go for the cheapest plan, and maybe that's not the right one, and that's kind of what we're trying to convey here.
Yeah, that always concerns me. That concerns me a lot, Eric, that that they're just shopping a premium and not taking into account all the out-of-pockets. And so, Sherrie, do you find that it becomes an issue when somebody's still working, the fact that they have a pre-existing condition of some kind, does that affect going on Medicare, at 65 or delaying and staying on their group insurance plan?
No, when you first turn 65, there's no pre-existing. Medicare supplements aren't going to ask you any health questions, nor are the Advantage plans. So one of the things to consider is the cost of your prescriptions. I have clients who stay on their employer plan because that employer plan covers those prescriptions much better than what the Medicare plans do. But if you're staying on your employer plan, it's important to know that if your employer is under 20 employees, Medicare is going to be primary. So you're going to want to make sure that you do sign up for your Medicare Part A and B at that time. And then you could always use your employer as the secondary insurance.
So do you get, when you're 65, are you automatically enrolled in Part A?
Yes.
Okay.
If you or your spouse have worked 40 quarters or 10 years over the course of your lifetime and have paid the Medicare taxes, then you are automatically eligible. And if you have been collecting your Social Security, you're automatically enrolled. If you haven't been collecting Social Security, you're going to want to sign up for your Part A and Part B. And you can do that through the Social Security office. We have a number on the screen with the numbers that we have that you can call.
Yeah.
Or you can get online at Social Security and fill out your application there.
Okay, great. Also, we wanted to touch upon something that a lot of people don't realize, Bill, and this is called we call it the IRMA tax, right? And so if your income is over a certain level of income, then you are subject to, an additional cost for your Medicare.
That's correct.
And
that's correct, Eric. The income-related monthly adjustment amount goes up, over 174,000 and continues to go up and away. And when this can be, we've talked on this show about doing Roth conversions, and that's an important number for us to take into account when we're doing Roth conversions, because we could be impacting a client's Social Security by them receiving less, because these Part B premiums comes out of the Social Security if they're receiving it, and so that can be an issue.
Yeah, and the other thing about that, is once you reach that threshold, $1 over into that threshold, and you are now paying that additional premium. So it's a great point, Bill, about, we obviously are Roth conversion fans when it makes sense, but you need to understand that it may pump you into the next, into some additional costs. And then the other thing is that's important to remember is that they take 2-year prior income. So right now they're looking at 2018, and if your situation has changed, like you have retired and you're not working and so forth, you can, appeal that to make, if your income gets dropped. So, so anyway, now to sign up for Medicare, you can call Social Security Administration, as Sherrie mentioned. There are 800 numbers on the screen. You can also visit their website at socialsecurity.gov. This month is also Cybersecurity Month across the nation. We all do so much business online these days that it's really critical to protect yourself and your finances. And the pandemic has also increased opportunities for scammers and hackers. Next week on Your Wealth Health, we'll talk to one of this nation's most respected cybersecurity experts, and he is our cybersecurity expert, Robert Siciliano. This is what we had to say a few months ago when we had him talk with us right here on this show.
I've been providing security awareness training for more than half of my life, right? So for 25, 30 years, I have seen it all, really. But never have I seen so much fraud being perpetrated in such a short period of time.
So again, Cybersecurity with Robert Siciliano, October 24th, right here on Your Wealth Health. Well, we're out of time today, and I want to thank you for watching, and we want to thank Sherrie Kramer for joining us with her expertise today, and we'll see you next week on Your Wealth Health. Until then, stay wealthy, Michiana.